It is the smaller terminal branch of the brachial artery in the cubital fossa. Course. It begins from the brachial artery, runs downwards to the wrist with lateral convexity. It leaves the forearm by turning posteriorly and entering the anatomical snuff box. Comparing to the ulnar artery, it is superficial throughout its whole course. It leaves the forearm by winding backwards round the wrist. In hand, it passes through the anatomical snuff box where it lies deep to the tendons of the abductor pollicis longus, the extensor pollicis brevis, and the extensor pollicis longus. The artery is superficial to the lateral ligament of the wrist joint, the scaphoid, and the trapezium. It reaches the proximal end of the first interosseous space and passes between the two heads of first dorsal interosseous to reach the palm. In the palm, the radial artery runs medially. At first, it lies deep to the oblique head of the adductor pollicis and then passes between the two heads of this muscle. Therefore, it is known as the deep palmar arch. Relations. Anteriorly, upper part overlapped by brachioradialis, lower part covered only by skin, superficial fascia, and deep fascia. Posteriorly, biceps tendon, supinator, insertion of pronator teres, radial origin of flexor digitorum superficialis, radial origin of flexor pollicis longus, pronator quadratus, lower end of radius. Medially, upper 1/3 pronator teres and lower 2/3 flexor carpi radialis. Laterally, brachioradialis in the whole extent and radial nerve in the middle 1/3. Branches. In forearm, first radial recurrent artery. It arises just below the elbow, runs upwards deep to the brachioradialis and end by anastomose with radial collateral artery in front of lateral epicondyle of the humerus. Second, muscular branches. It gives branches to the lateral muscles of the forearm. Third, palmar carpal branch. It arises near the lower border of pronator quadratus, runs medially deep to flexor tendons and anastomose with the palmar carpal branch of ulnar artery. Fourth, superficial palmar branch. It arises just before the radial artery leaves the forearm. It passes through the thenar muscles and ends by joining the terminal part of ulnar artery to complete superficial palmar arch. Dorsum of the hand. The radial artery gives off branch to the lateral side of the dorsum of the thumb and first dorsal metacarpal artery. This artery arises just before the radial artery passes into two heads of first dorsal interosseous muscle and then it divides into two branches for the thumb and the index finger. In the palm, the radial artery gives off first the principus pollicis artery. It divides into two branches for the palmar surface of the thumb. Second, the radialis indicis artery. It supplies the lateral side of the index finger. Clinical anatomy. The radial artery is used for feeling the arterial pulse at the wrist. The pulsation can be felt well in this situation because of the presence of the radius behind the artery.